Hi mummies and daddies, welcome back to AskMeDoctor by MotherhoodSG, where we speak to experts about the everyday questions parents are constantly Googling, overthinking and asking in parent group chats. I'm Michelle and today we're talking about something that sounds simple until you actually have to choose one: feeding bottles. If you are a parent like me, you know that it's not just about choosing the cutest bottle or assuming the most expensive one must be the best. There's comfort, milk flow, air intake, nipple softness, ease of cleaning, and whether the baby can accept it comfortably, especially if you're switching between direct feeding and bottle feeding. So, if you've ever wondered, what am I actually supposed to look for? This episode is for you. Today, I have Dr. Amy Wang, a board-certified pediatrician, with us to break it down in a simple, practical way. Hi, Dr. Amy. Thank you so much for joining us.
Hi, Michelle. Thank you for having me. Very happy to be here.
Doctor, feeding is such a big part of life with a baby, but when it does not go smoothly, it can feel stressful very quickly. So let's start with the basics. When choosing a feeding bottle, what should mothers actually look for beyond the price, design, or what everybody else is using?
Feeding bottle is a rather personal choice. I will break it down to two components. One is whether you as a parent actually like it, how it looks like, how it feels, because you'll be using it very frequently, what materials it's made of, how easy it is to clean and sterilize frequently. So choosing a bottle that fits your child's feeding pace, as well as reduces the amount of air that your child swallows, will make feeding a lot more comfortable for your baby.
So that makes a lot of sense, of course, because in real life, feeding is not always very calm and picture perfect. Sometimes you could be feeding your baby at 2 a.m. Sometimes the baby's crying and you're trying to prepare the bottle while half awake and running on very little sleep. So it really has to be something that supports the baby, but also makes the routine easier for parents.
That's right. A calm parent helps baby to remain calm and also vice versa.
So now let's move on to talk about milk flow, because you mentioned milk flow just now. Why is it important for a feeding bottle to allow milk flow according to baby's natural sucking action?
So as you can imagine, even as adults, we will feel frustrated when we drink through a straw that is either too thin or too flat, and it takes a lot of energy just to draw the fluid up. But on the other hand, if the straw is too thick, like for example a bubble tea straw, when there are no pearls inside, you can actually be too overwhelmed by the fluid that you are drinking up. That is also the case for babies. So if the flow is too slow, and the baby can feel frustrated and even tired from drinking, but if the flow is too fast, they can be overwhelmed, struggling with the amount of milk that's coming through. They may even cough or choke. So finding a bottle and a teat that helps to match baby's sucking and pausing and swallowing rhythm will be very helpful.
That makes a lot of sense, and I like that you mentioned rhythm just now, because sometimes we think feeding should be quite straightforward, right? Baby's hungry, baby drinks, done, but actually baby pause, they breathe, they swallow, and they continue when they are ready. So when a bottle supports that natural pace, feeding can feel a lot less rushed and a lot more comfortable for both parents and babies.
That's right, and it sometimes takes trial and error to find that sweet spot, and even then the sweet spot can change when the baby grows.
Dr. Amy, another thing that parents hear a lot is air intake. So explain to me, how can swallowing too much air affect a baby during bottle feeding?
So a baby's stomach is only like this small, and if they swallow too much air, they can be bloated easily, they can be uncomfortable, and when that happens, they cry. When they cry, they ingest even more air. And even when their tummy is so full of air, they can end up drinking less milk than they actually need. This makes them become fussier easily, hungrier easily, and it sets up a vicious cycle. So having steps to reduce the amount of air that the baby swallows will be helpful. For the bottle, if it's vented, it can help to reduce the amount of air that is swallowed. Another thing that as caregivers we can do is to pace the feeding. For example, example, you can tilt the bottle downwards, slow down the flow according to the child's pace when he's feeding. Secondly, you can also make sure that the teat is always filled with milk so that they are not swallowing air. But inevitably, they will tend to swallow some air, so to release that, it will be the good old burping during as well as after the feed.
That is such a familiar situation, the burping. So let's say, okay, so you finish feeding and instead of sometimes, your baby looking full and settled, baby may start crying and look uncomfortable. And this is when parents start doubting themselves and start wondering, is my baby still hungry? Is it gas? Is it the bottle? So now I know it is ventilation. It's not just a small extra feature. It actually plays a role in how comfortable a baby feels after feeding.
That's right. Having a vented bottle will definitely help to reduce the amount of air the baby swallows during feeding.
So now the next one, Dr. Amy, is especially helpful, I think, for mums who direct feed, but also need to introduce bottle feeding because maybe they're going back to work, maybe they have another carer to help, or maybe they just need a little bit of flexibility, like going out and making sure that there's food or there's milk for the babies, right? For mothers in this situation, what bottles feature can help support the switch?
That's a very good question, Michelle, and it's a question that a lot of mothers grapple with, especially for working mothers. I would say that a bottle and teat system that helps with this transition is very important. One that helps to mimic the natural breastfeeding experience, the breast milk flow will be helpful. For example, if mommy's breast milk tends to be on the slower flow rate side, finding a bottle and teat system that helps to have a slower rate will help baby transit more easily back to the breast and not be so frustrated with the slower flow rate there. On the other hand, on top of bottle features is also very important to help baby remain familiar after a bottle has been introduced. So I would encourage parents or caregivers to introduce a bottle maybe once a day, perhaps by another caregiver, so that baby remains familiar, comfortable, caregivers are confident, and it's a lot less stressful when mummies go back to work eventually.
That is such an important reminder. So consistency and familiarity. Great. So, and I think that most moms often feel so pressured when their baby does not accept a bottle immediately. And especially if you're a working mom, it can feel even more stressful because you're trying to prepare a baby, prepare yourself, manage pumping, manage work, manage a home, and somehow still trying to function as a human being, especially in those early months. So having a bottle that feels more familiar and comfortable can help make that transition a little smoother, yeah?
Definitely. If baby is transiting well between the breast and the bottle and back to the breast again, it will definitely take a huge load off mommy's mind before she goes back to work eventually.
Now, on to the final segment, and one I think many parents are waiting for. Does choosing a high-quality feeding bottle always means mothers have to pay a premium price?
So that's $1 million question. I guess the question is what high quality actually entails. If you purchase a product that is of good or high quality, but your child actually doesn't like it, to you it is not of high quality. So personally, when my daughter was still a baby, I chose a high quality, premium price product, being very hopeful that she would like it. But after repeated tries, when she wouldn't have it, we had to switch gears, try different bottles, different teats until she was happy to bottle feed again. I guess it's a very personal choice and even preferences change over time. So in conclusion, I don't think that premium price is necessarily the best for your child. Just choose something that you're happy and comfortable with and your baby is happy and comfortable with.
Thank you for the tip, Dr. Amy, and I'm sure a lot of parents feel very glad to hear that answer because especially for a new parent, sometimes we feel like we must buy the most expensive option to make the right choice. But really, it's really not about choosing the fanciest bottle for your baby. It's about choosing one that supports your baby, it fits into your routine and gives you confidence during feeding.
Exactly. Very well said, Michelle.
For parents who want a feeding bottle that focuses on a baby comfort without the premium price tag, Pureen Soft Flex is designed with thoughtful features that support smoother, more comfortable feeding. It is made to help support the baby's natural sucking action, so milk flow when the baby sucks and pauses when the baby pauses. This helps the baby feed at a more comfortable pace without the milk flowing too quickly. It also comes with an anti-colic venting system that helps minimize air intake during feeding, which may reduce wind, fussiness, and discomfort. The soft and flexible nipple with a wide base also helps to create a more familiar feeding experience, especially for moms who are switching between direct feeding and bottle feeding and back. And because parents already have enough on their plate, Pureen Soft Flex is also designed to be practical for everyday use, from its bottle material to its easy-to-hold design and cleaning routine. So, if you are choosing a feeding bottle, remember, it's not just about how it looks or how much it costs. It's about comfort, safety, feeding support, and whether it works for your baby everyday needs. And alright then, doctor, before we wrap up, what would be your final advice for parents who are currently choosing a feeding bottle?
I'll say firstly, choose a bottle that is vented and that has a bottle and teat design that suits your child's feeding pace. Number two, choose one that you as a parent like, whether it's the materials it's made of, how easy it is to clean, and whether it fits into your lifestyle. Thirdly, whether or not your child finds something that your child actually likes, but be patient because this can take trial and error.
Thank you for that, doctor. And mommy and daddies, if you're looking for a feeding bottle that supports your baby comfort while keeping everyday feeding practical, you can check out Pureen Soft Flex bottles. Parents can find Pureen Soft Flex bottles at Kiddie Palace SG or shop anytime at the Pureen Singapore official store on Shopee, Lazada, and TikTok. Parenthood made easier, one bottle at a time. Thank you for watching this episode of Ask Me Doctor by MotherhoodSG. I'm Michelle.
And I'm Dr. Amy Wang.
See you in the next episode. Bye-bye.